It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events, and get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to Morton in the Morning. Thank you so much for tuning in as we join you every week at 11:05 a.m. Every Wednesday right here on WVBF, your hometown radio station. We are broadcasting from Morton Hospital, your community hospital in Taunton, and we have a great show lined up for you today. We will be interviewing one of our specialists who practices in the community. In fact, right here in the Thayer building at Morton Hospital. His name is Dr. Mike, and he is a podiatric medicine and surgery specialist. And we'll be talking about a very important topic, which is diabetic foot care. So tune in, listen into that. There's a lot of great information, tips, talking about prevention and what you should do to take care of your feet in general, but also if you do have diabetes or if someone you know has diabetes, then you'll definitely want to listen in to hear that great information. Before we jump into our interview, let's talk about what's happening out in the community. We hope everyone's been enjoying finally some very nice weather, although it's certainly been a very rainy July thus far, but we've been participating in some great community events. In fact, just this week on Monday, we were the gift sponsor of the Cranberry Country Chamber of Commerce's annual golf outing and fundraiser. So we had a team participating, enjoying a great day of golf with our fellow chamber members and members of our local business community. The Cranberry Chamber always does such an amazing job with their events. They had a great turnout, and it was just a great day of supporting the chamber and local businesses. So we want to thank them for the great job and for the great time that our team had Monday at the golf outing. We also have some other great events coming up in the community, and there's still time to sign up for some of those if anyone listening out there is interested. We have two more great golf fundraiser events coming up in August. The first is on August 16th, and it's the Taunton Area Chamber of Commerce's annual Golf Classic. I know that they are still looking for players and sponsors and donations of raffle prizes, so please reach out to the Taunton Chamber if you have any interest. We are a sponsor of that event and look forward to being there and hopefully another beautiful day of golf. And also the Boys and Girls Club's Golf Classic. So it's the Boys and Girls Clubs of Metro South. We are the cart sponsor of that event, of their Golf Classic, on August 30th. So another event we're looking forward to. Also in August, the Cranberry Country Chamber of Commerce, they're doing their annual Elements for Excellence event, which is a professional and personal development event for women in business and women throughout the community. So they have a lot of great speakers lined up, and it will be a virtual event. So any women out there interested in participating, you can check out the Cranberry Country Chamber of Commerce website or their Facebook page. Both our Cranberry Chamber and Taunton Chamber are very active on Facebook, and they always post all of their great events and upcoming programs on those pages. So take a look. We look forward to participating in those events, and hopefully you too will come out there and join us as we support some great community organizations and local businesses in our community. So with that, let's dive into the interview portion of today's show. Today, we are so happy to be here interviewing Dr. Michael Skonieczny, or as many people more commonly know him, Dr. Mike. He is one of our podiatric medicine and surgery specialists who practices right here in the Thayer building at Morton Hospital, and we are recording right from his office today. So, Dr. Mike, thank you for being here with us.
Well, thank you for having me on.
Yes, again. So we've had you on previously, so we're happy that you took the time to dive a little bit more into a very important topic that we want to talk about today. But first, for those who didn't hear your initial interview a few months ago, why don't you tell us a bit about yourself and your practice?
So my name is Dr. Michael Skonieczny, as you all know. But again, most of my patients and probably most physicians will call me and refer to me by Dr. Mike. I don't understand why. My last name seems pretty easy to pronounce itself.
It's pretty easy.
Yeah. Just to give you a quick background check on myself. I'm a board-certified foot surgeon here out of Morton Hospital here in the Thayer building. We treat all different sorts of pathology from toenail fungus all the way to major reconstructive rear foot and ankle procedures. So if you really need anything foot and ankle wise, feel free to come on in. We'll give you the full workup and get you taken care of.
All right, and how long have you been in this practice?
I came back out to Massachusetts in 2016, so this is going to be year 5 for me being back out in the area. I did train for 3 years out in Rhode Island, where I did a heavily reconstructive rear foot ankle surgical residency program. Went to New York for 2 years. Didn't really like it out there, and I came back to good old New England, and here we are.
Excellent. And now the Thayer building office, it's been a little over a year now since you've been here. Is it longer?
So we moved in just as the pandemic hit last year.
Good timing.
Yeah, it was great timing. But it's been great here. It's a really good location, and what makes the location so good for us is that the ability to be able to not only see our patients here, but for our in-hospital consultations, we do consultations within the emergency department, be able to do our surgery. It's all easy access we can get to on foot and to get to where you need to be pretty quickly.
Very convenient. So talk a little bit about your areas of expertise, or if there's any areas that you have a special interest in treating.
So I think for me, my biggest interest is I love surgery. I think surgery is a big part of what I like to continue doing, because a lot of times when people come to my office, with either like end-stage arthritis, flat feet, bunions, hammer toes, it's affecting their everyday life, and it's causing them a great deal of pain to where they can't do and can't perform up to their expectations. So to be able to really change somebody's life through the power of fixing that deformity itself and giving them a long-lasting change, to me is very gratifying, and be able to see the results of these cases, from start to finish, to the point where, hey, thank you so much, I'm able now to go out and do my 5-mile runs again. I'm able to go and play with my grandkids, things like that.
That's great. Now, I understand that one of the more common conditions that you treat here in the office are complications that have to do with patients with diabetes. So can we talk a little bit about diabetes and how it affects one's lower extremities?
Absolutely. Diabetes is one of the growing, diseases in this country. Every year more and more people are becoming sick with diabetes, and it has very long lasting effects to not only the overall health, but especially and particularly to the lower extremity. It definitely can affect people regards to orthopedic issues, to how their foot's misshapen, to neurological issues, to where they can't feel well, and also can cause prominent areas to where there's wound complications to it. So it's a very, very broad topic. If we really wanted to, I could probably talk to you hours about diabetics and diabetes and how diabetes affects the lower extremity, but also we'll kind of do a quick synopsis today on what it can do and what can be done to prevent it today.
That's great. I would love to dive further into that. So I think it's interesting because, when you think about diabetes, you don't always think about the complications of the lower extremities. I think that might be just, not top of mind for most people. And you mentioned a lot of, serious issues. So definitely want to take some time today to highlight those so that the community is well educated about what can happen if you don't take care of those issues and take good care of your feet. But first, before we get into that, we do have to take our first break of today's show. So if you're just tuning in, we are speaking with Dr. Michael Skonieczny, or Dr. Mike, a podiatric medicine and surgery specialist right here in the Thayer building at Morton Hospital. When we return, we're going to start to talk a bit more about some of those serious complications that can happen with your lower extremities for patients with diabetes if they're not taking care of their feet, or looking for those warning signs of some of those serious complications. So stay with us. We'll be right back after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's Morton in the Morning show. I'm your host, Julie. Thank you for joining us today. Today we are speaking with Dr. Michael Skonieczny, who is a podiatric medicine and surgery specialist practicing in the Thayer building here at Morton Hospital with his colleague, Dr. Eric Henriksen. We have been talking a bit about his areas of expertise, about their practice here in the Thayer building, and started to talk about the topic of patients with diabetes and some of the complications they can experience. And, what you had highlighted is some of those complications can be very serious. Do you want to highlight any specifics within regards to those topics that you mentioned, the neurological? So talk about what happens if they can't feel their feet.
Right, so with diabetes, it not only just makes your sugar high, but what happens when the sugar is that high, it actually can affect the nerve endings in your lower extremity, especially starting with the tips of toes, even the tips of your fingers. And as the diabetes, prolongs over years and years, especially if it's not taken care of the right way, it can get worse, affecting the nerves. What then happens is you can have an array of what happens, meaning you can get just pure numbness to where you can't feel the feet, which we call peripheral neuropathy, or you can develop severe pain, burning, stinging, which you get neuropathic pain. Because there's three different ways, the three different nerve tracts, to say, that affect the lower extremity through pain, sensation, vibration. As we don't need to get into details about that, but what makes it very difficult, especially, is those neuropathic patients who have that loss of feeling. They can't feel when they're walking. So what happens is they may be in a pair of shoes that are too tight, that are causing rubbing and friction. They may have stepped on something, not known what's happened, and honestly, those can lead to ulcerations, wounds, infections, and severe complications down the road.
Okay. Now, what are some of the more common orthopedic issues related to diabetic foot?
So again, kind of almost piggybacking onto the neurological issues, is most orthopedic issues also are from having those neurologic issues, meaning you can't feel. Say you drop something in the house on top of your foot. Well, you may have broken a bone, but you don't realize it because, you can't feel. You may notice the foot's swollen, you're walking around, it feels a little funny, but I'm doing okay. You necessarily don't go in for treatment right away, and then it's one of those manifestations where someone comes to the office, hey, it's been 3 months, my foot's swollen, take an x-ray, you have an old fracture there. I don't recall off the top of my head, and then usually after kind of digging in more, I do recall I dropped something on that foot, or I sprained my ankle months ago, but I didn't think anything of it because it didn't really hurt. The other more common and really more severe thing that occurs with diabetics orthopedically is a deformity called Charcot.
Okay.
What that is with a combination of, again, the neuropathy, so you can't feel. So in order for you to kind of feel while you're walking, you tend to slap the foot harder onto the ground, which then can cause these fractures and dislocations into either the forefoot, the middle of your foot, or even the rear foot and ankle, which then can cause collapse. And these people will start noticing that their arch is collapsing.
Wow.
Hey, doc, what's going on here? I've noticed over the last several months my arch is collapsing. My left foot looks great, but my right foot is having complications and issues. And at that point, you start to realize and taking pictures that, hey, you have a severe issue going on, and it's something that sometimes needs to be dealt with, surgically in order to fix the issue, or offloading with different, walking shoes, things like that.
Okay. Now, with the combination of, you have an injury, but you have the neuropathy, so you can't feel it. If an orthopedic condition related to the foot is found, later, if it's been there for a long time, is it harder to treat later down the road? It
is, and that's where, probably seeing a podiatrist pretty frequently, would benefit these patients. Because if you do come in, every 9 weeks or so, which most insurances will cover that kind of podiatric care, we're able to start picking up on things, noticing, hey, that doesn't look right, let me send you for this, or be able to get you into an offloading device sooner rather than later. Because when it gets to that end stage where you haven't seen somebody, at that point now you're usually dealing with a wound complication. You're dealing with, hey, you need to be in this special brace or boot for months upon months in order to offload it, or it's to a point it's so bad that we need to do a reconstructive surgery, which, is a long time being laid up afterwards.
Okay. Now, so we've talked a little bit about the neurological, we've talked about the orthopedic. Now, the wound complications. So, actually, for our interview today, you were coming from our wound center because you are one of the 3 podiatric specialists that's on our provider panel in our wound clinic. So, can you talk a little bit about why it's important for us to have podiatric specialists in that clinic?
Well, exactly, because again, the issue is with diabetes, again, not only do you have these complications associated with it, but when you do develop these wounds, it takes you a lot longer to heal them, just for the simple fact of having the diabetes. And on top of that, it puts you and makes you more prone to having, susceptibility to being infected, meaning that, say the average person has a cut in their foot, well, usually put a little Neosporin, a bandage on it, you can heal it. But these diabetics, they get a sore in their foot and lower extremity, that can blow up in a matter of 2 to 3 days to where they have a huge abscess that requires, an in-stay hospital visit, surgeries, things like that. So what we try to do here at the wound clinic is to be able to get those wounds that are maybe that are on the border of they've gone too far neglected. Now we need to make sure we offload them, treat them properly, and get those wounds closed and healed. That way we can decrease that risk for any infection or any hospital stay going forward.
Okay. And what types of treatment options do you have for people with diabetic wounds or, injuries to the foot and ankle area?
So down the wound clinic specifically, one of the greatest things we have is the hyperbaric oxygen treatments there, which is a fantastic for these patients who say have already had a bone infection, have been treated for it, and they need further treatment, and it hasn't healed well. On top of that, we use many different types of wound graft down there, collagen dressings to help facilitate the healing at the wound sites themselves, as well as other offloading devices such as total contact casts, walking boots, etc. And with the constant debridement really important as well, because one of the biggest thing too with these wounds and diabetes is they get stuck in what's called the inflammation stage. So your body doesn't want to move on to the reparative stage in order to really heal it. So what we do as podiatric surgeons down there is we clean the wound and re-stimulate the wound to kind of get it moving and to make it realize, hey, we're stuck in this phase. We need to get to the next phase here to get this to close for them.
Okay, interesting. So what would you say are some of the warning signs of foot problems developing in someone with diabetes?
Well, obviously, if any cut or laceration to your foot, go and see a wound specialist or a podiatric physician, because, again, you may not think it's a big deal, and, more times than not in the past, you probably have dealt with it on your own without seeing anybody, and it's healed on its own. But as time goes on, there's going to be, that time where it doesn't heal the right way and to where you have that complication. So I always like to tell my patients, I'd rather you overreact and come in sooner and me tell you, hey, it's not a big deal, we'll take care of it, versus, I'll wait a few weeks and see how it goes. So really, anytime you notice any cuts, any sores, you notice your foot swollen, it's having pain when you normally don't have, you can't recall any injury, you start noticing redness, an odor, drainage, anything out of the ordinary, you should go and seek treatment.
Okay, and those neurological ones you spoke about earlier too, like when you maybe start to feel tingling, or if you start to lose sensation maybe in the feet,
right,
that's a problem.
Absolutely, and that's a good time to start seeing somebody to make sure, again, there's nothing else going on, and basically help educate people too to make sure that they know what to look out for in the future.
Okay, and would you say that foot problems in people with diabetes, are they preventable?
I mean, they definitely are preventable. I mean, a good way to say it is, my patients who do come into the office for regular routine visits much less frequently wind up in the emergency room or admitted for any complications and problems. Why? Well, because they're being treated here. We're able to catch things early and prevent them from going on to the end stage.
Okay.
The people who are generally in the hospital or have severe complications are people who tend to not show up regularly for visits, and then they wind up in the hospital, and sometimes it's too late for them.
Okay. And are there any sort of lifestyle modifications that people with diabetes should keep in mind to prevent, more serious issues or conditions?
Right, and one of the first things I tell all my patients is no smoking, because smoking obviously can complicate things, and on top of diabetes, you're kind of just signing up for having, a lot of complications with it. Making sure you eat a well-balanced diet, staying away from any sugar, staying away from the sodas. One of the biggest misnomers people have is that, well, doc, I drink diet soda. Well, that's actually worse for you than drinking regular soda. And this to kind of give you the insight to that is, well, when you drink a diet soda, your body's tricked into thinking that there's sugar in the body. So it releases the insulin to be able to take care of it, but then when it sees there's no sugar, your body then gets trained that, well, now I don't have to release that insulin. So the problem is now anytime you eat any sort of sugar, your body won't release the proper enzymes that break down those sugars properly, which then causes your diabetes to be out of control.
Okay.
So I have people stay away from any soda. Try to drink water. Try to eat healthy, stay away from the carbs. That's another big thing, because people love their pasta, and I don't blame them. Again, being part Italian, I grew up eating pasta all the time, but carbs, sugar, cake, pastry, desserts, all that type of stuff, it's never going to be good for you. And always I tell people, if you keep your diabetes under good control and you want to have a splurge moment every now and then, by all means, have something. I'm not going to tell you can never eat that again, but if you're having your sugars constantly elevated and you're having issues, you really need to do your best to stay away from that type of stuff to help prevent any further complications down the road.
Moderation is key.
Absolutely.
And what is it about smoking that is not right for folks with diabetes?
Well, because again, the diabetes, it affects an array of issues, but also can affect the arteries and capillaries in your lower extremity.
Okay.
And what the smoking does itself on top of it can cause plaque buildup, can cause vasoconstriction, to where the blood supply getting down to the lower extremity now becomes compromised, which even further complicates the healing of any issues down the road. What happens is you get these complicated wounds, and now you have to compromise circulation. So now, on top of the diabetes, which is preventing your healing process, now the smoking causing the arterial supply and blood flow to be diminished now compromises that further, and sometimes then it winds up needing further intervention by a vascular surgeon. So we do generally work a lot as podiatrists with the vascular team here in order to kind of send patients back and forth to get those patients reperfused the right way, and that way to help maximize your healing time as well.
Okay, that makes sense. Lots of great information here already. Thank you, Dr. Mike. And I do have more questions for you. I do want to get into your tips and recommendations about how people can best protect their feet, especially with the summer months coming. It is just about time for us to take our mid-show break and listen to a brief commercial. But before we do, I do want to remind our listeners that you can contact us anytime at Morton in the Morning. If you are enjoying the show, we'd love to hear your feedback, or if you have any ideas of topics you'd like to hear about and on future shows, any sort of educational topics or anything that's going on at the hospital, or if you have any questions that we can answer for you on air, you can certainly reach out to us at any time. We have a special email address set up, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org, and we would be happy to hear from you. We do check that email regularly, so please feel free to reach out to us at any time. So let's go ahead and take our second break of today's show. We will be right back after these short messages with more with Dr. Mike Skonieczny of our Podiatric Medicine and Surgery office here in the Thayer Building at Morton Hospital. Stay tuned.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Steward Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone. Welcome back to today's Morton in the Morning show. We are halfway through today's show, and we're happy to be joining you with a new show and an interview with one of our specialists who practices here in the Thayer Building at Morton Hospital. We are talking with Dr. Mike Skonieczny, or better known as Dr. Mike, who is a podiatrist. He has been practicing in the Thayer Building here at Morton Hospital for just over a year now with his colleague, Dr. Henriksen. We are so fortunate to have them on our team. And today we are talking about foot and ankle or lower extremity complications that can be caused by diabetes. So before we took our break, we went over some of those complications, whether they are neurological issues, orthopedic issues, or wound-related issues. And we also started to talk about the various risk factors for those issues and some of the things that you can try to do to prevent those, including some lifestyle modifications such as quitting smoking. But right now, I do want to hear more from you about your tips or recommendations for how people can take care of their own feet and best protect their feet. So what are some things that patients with diabetes can be doing at home to best either care for or protect their feet from injuries and whatnot?
So one of the biggest things, especially with summer coming up, is people love walking barefoot outside.
Yes.
I tell you, don't do that. That's probably one of the biggest no-nos I can say. Because again, due to those neurological issues, you may step on something and not realize it. And then by the end of the day, now you've had to say this like rusted nail in your foot all day. And it's causing an infection, starting to brew. The other thing, which I've seen beforehand, is people who have neuropathy, they're standing out in the pavement barefoot. The pavement's hot. They get these severe burns on the bottom of their feet that have issues too. They become complicated, and then they usually come to see us in the wound clinic for treatment afterwards. So obviously, avoid walking barefoot.
Okay.
Checking your feet every single night. If you can't see the bottom of your feet, two things you can do is either have a spouse or a family member check the bottom of your feet for you. Also, if you have no one at home, put a mirror on the floor. Be able to look in the bottom of the feet, again, to make sure there's no issues, there's no complications. Make sure you check in between your toes. Dry off real well in between your toes, after the shower and stuff like that. Check your shoes before you put them on to make sure there's no pebbles, no stones, things like that. You'd be surprised things people find in their shoes, especially if they have grandkids around the house. They may not realize that's in there.
Absolutely.
And basically taking good control of your overall foot health, hygiene, making sure you're wearing clean socks. And always wear socks with your sneakers as well. Make sure you're changing your shoes out properly. If you're having sneakers, I would say every year get a new pair of sneakers. If you're walking a lot and you're very active, get a pair of sneakers every 6 months or so to make sure you're having something that's giving you proper support on your feet.
Okay. Funny story and true story, my father actually walked around all day one day because he does have neuropathy of his foot with a bullfrog squished inside of his shoe. So he didn't even know it was there until he took off his shoes later in the day. So you mentioned, we talked a little bit about summertime. You know, what other advice do you have to prevent foot problems and injuries in the summer months other than walking barefoot?
Right, and I think it's the big thing. Don't walk barefoot, don't walk barefoot, don't walk barefoot. That's the biggest thing. And, you know, again, it's the summertime. You're going to want to be, you know, having fun, especially after, you know, this post-COVID and we were able kind of all, you know, trapped in our homes forever. But just try again to maintain a good, healthy lifestyle. Try to stay active. Try to eat healthy. Don't try to overindulge in certain things like the desserts, the drinking, the the carbs, the sugars, all that type of stuff. Again, and just wearing, you know, good shoes and sneakers on your feet, and again, making sure you see your podiatric physician on a routine basis.
Now, I understand that you actually have a diabetic shoe program right here in your office, so tell us about that.
Yes, so here in our office, if you have Medicare, you know, Medicare will cover a pair of diabetic shoes and 3 pairs of diabetic inserts for you every year. And what's great about that is that it's a program that's basically set up to help prevent any complications in the future. You know, so what we do is we will custom measure your feet, length, width, circumference of the foot, and be able to make any connotations and notations on our sheets that we submit. You have bunions, you have hammer toes, things like that. And that way, we get a shoe that fits you not only just lengthwise, but width, and also a high enough toe box to help prevent any rubbing and irritation, which help decrease the complications.
Okay.
On top of that, we give you these nice accommodative inserts, same thing, to help offload those pressure points you may have on the bottom of your feet. You maybe have a callus on the bottom of your foot because, you know, one of your metatarsals is plantar flex too much, or you have a bunion which is causing rubbing in the side. These shoes and inserts, you know, afford you the likelihood to help prevent any issues or any wounds from forming, and you know, make sure that you're able to go out and have a good fitting shoe. And what's nice is it's every year, so every year you can get a new pair of shoes or sneakers in order to make sure that you have one that fits right, it's not worn out, and that you have the proper support you need.
Yeah, I was going to ask a little bit more about, you know, what are the traits of a good quality shoe for anyone, just in general? What are the things you should look for?
Well, exactly. I mean, any shoe you really look for, you know, I try to tell people, you know, one's the heel counter, meaning the back of your shoe. If you can take that and squish it down, it's not good and sturdy for it. You want to be able to, if you're just kind of squeezing, it's type of stiff, and obviously not too stiff, but enough to where it's going to hold your heel in place. The other thing is when you go to, you know, push the shoe from the toes forward, it really only should bend where your toes would be bending. If you are able to take it and fold it in half like a sandwich, again, probably not the best support. Another little quick test I tell my patients to do is take your shoe and be able to twist it like you're wringing a towel out. If you can wring it all the way like a towel, again, not good support for, you know, side to side stability. Your foot's going to be sliding and causing issues and complications. You want to make sure it has stability and you're unable to really twist it a lot, because that way, if you all 3 of those concepts, you know, your foot's in that shoe, you should have really good support. Your foot shouldn't be trying the grass, shouldn't be slipping and sliding, and you'll be able to have less complications going forward.
Okay. So again, so the diabetic shoe program, you said it's a certain insurance program that covers that, any insurance?
So a lot of insurances will cover them. Right now, we only have the license agreement with Medicare. We're looking to hopefully expand that in the future to other private insurances as well. And again, if you have another private insurance, I mean, you can purchase them from us here. We have a cash option as well. If there's a place nearby we can send you to, we can obviously give you a prescription and send you one out that way as well.
Yeah, but either way, you're happy to help people, talk about the right shoe for them,
Absolutely.
help them find the right shoes based on whatever condition they may have. So now, if someone is interested in coming to see you here in the office, are they able to self-refer, call in? Do they have to be referred by a primary care provider or another specialist?
If you have Medicare or any PPO plan, you're able to just call, make an appointment. HMOs, a lot of times you'll have to get a referral from your primary care physician. So if you're unsure, just give your insurance company a call. They'll be able to help better answer that than we can. And obviously, we have staff here 5 days a week able to answer the phones for you, able to answer any questions. If you can't get through to somebody, you can leave a message with our answering service. They'll leave us a message that we can call you back as soon as possible, because sometimes people call during their lunch breaks when we're on lunch too.
Sure.
But we'll try to get back to you, as soon as possible to be able to get you in ASAP.
Okay. All right, so any other final tips or anything else you want the community to know about the services you have available here?
Like I said, again, we will treat anybody from toenail fungus to shaving calluses, which is big in our diabetic program here to help prevent those complications from occurring. But again, we offer all services: bunions, hammer toes, flat foot, ankle sprains, osteoarthritis, any joint in the foot and ankle we'll take care of. Myself and Dr. Henriksen here in the Taunton office, we are more than qualified to be able to handle a lot of those orthopedic issues for you here. So obviously, if we're here anytime, give us a call. You'll see one of our specialists here, and we'll take good care of you, and we'll get you back on your feet and get you out there and be able to do what you want to do and not be in pain.
Great. And I know, like we had mentioned, you practice also in our Center for Wound Healing.
Mm-hmm.
Great team over there, and do the surgeries right here at Morton Hospital, so very convenient. How's the experience been going over the past year here doing the surgeries with our team?
Oh, it's great. I mean, I tell all my patients, because I do have other office locations too. I'm also in Plymouth, but I'll even tell my Plymouth patients, especially if I'm doing any more my complex surgeries, I want to come here because the staff here is just more well equipped to be able to help us out. And for me, it's more of a comfortable issue here with the staff, and they know what I need, they know what my expectations are, and nothing but great things to say about the staff here. Excellent. They're all fantastic.
Great. Well, we've been very happy to have you and Dr. Henriksen be part of our team. Very fortunate to have you also caring for patients in the wound clinic. And at the end of the show, I will give the phone number here to the office if anybody wants to call in and ask any questions or just make an appointment for a consultation. So thank you so much, Dr. Mike. We appreciate your time. And if there's any other topics you want to talk about in the future, or if we get any suggestions from our listeners, we will be happy to have you on the show again.
Perfect. Sounds great. Thank you for having me.
Thank you. Okay, well, that wraps up our time with Dr. Michael Skonieczny, or Dr. Mike. We want to thank him so much for joining us. Lots of great information about the areas that he can treat related to lower extremity issues, specifically related to diabetic foot issues. I certainly learned a lot, and hopefully you did too. As Dr. Mike mentioned, you can certainly call his office directly if you are interested in learning more about the services that they offer, or if you want to request a consultation in the office. The number to reach Dr. Mike and Dr. Henriksen at is 508-824-9571. Again, that's 508-824-9571. And they are right in the Thayer building at Morton Hospital, which is 72 Washington Street. They are up in Suite 2400, and like he said, they have staff here 5 days a week ready to answer your call, and they're happy to see you for any lower extremity issues or concerns that you may be experiencing. So thank you again, Dr. Mike. We look forward to having you again on the show, and perhaps we can discuss another topic. So it is now time for our final break of today's show. Before we do, again, just a reminder about how you can reach us here at Morton in the Morning. If you want to provide any feedback about our shows or ideas for upcoming shows, you can email us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org, and we would be very happy to hear from you and answer any questions you may have. So when we return from our final break, as we usually do, I'd like to provide some updates about what's happening here at the hospital, including some upcoming events. So stay tuned. We'll be right back after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning. here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final segment of today's Morton in the Morning show. Thank you so much for listening today. We hope you have enjoyed our interview with Dr. Mike Skonieczny, who is a podiatric medicine and surgery specialist practicing in the Thayer building right here at Morton Hospital. He has a lot of areas of expertise, including diabetic foot care, and we appreciate him coming on with us today and providing such great information about foot care and prevention of some common complications. So I would like to end today's show by sharing a few updates. First, let's start with some upcoming events and announcements. So the first is an announcement about one of our longtime providers who is actually retiring effective July 30th. And this Friday, July 23rd, we are having a little staff celebration and retirement reception for him. It's Dr. Moon Kai, who has been our chair of our radiology department. He has been that chair for the last 26 years. So we are so grateful for all of his contributions to our hospital, the care that he has provided to our patients, and for supporting our team. We're grateful for his dedication, and we want to wish him well in his retirement. Thank you so much, Dr. Moon Kai, and for those of you in the community who know Dr. Moon Kai, we hope you will join us in sharing your well wishes and appreciation for all that he has done for our Morton Hospital community for the past 26 years. Next Wednesday, July 28th, we have our next monthly virtual weight loss info session and support group. So you can join our Center for Weight Control team to learn about medical and surgical weight loss options available at our Center for Weight Control, and also gain support throughout your journey. So you learn a little bit about the medical and surgical weight loss options, but there's also a topic that's discussed each month, a support topic, whether it's nutrition or something motivational to help you keep up your weight loss and support you throughout your journey. So if you are interested in participating in that, it is again a virtual program, so it will happen via Zoom. It is Wednesday, July 28th from 3 to 4 p.m. And if you can't make this one, we do it on the last Wednesday of every month at the same time, 3 to 4 p.m. via Zoom. You can find the event online if you want to sign up online. If you go to our hospital page and look for our events page, or you can go to Eventbrite and search for the Morton Hospital Weight Loss Info Sessions. You can select the date and sign up there. Or you can always call our Center for Weight Control directly to sign up, and they will send you the link to participate. The phone number is 508-301-2434. That's 508-301-2434. And it's a great program, again, offered every month, and it is free and virtual, so you can participate from the comfort of your own home or wherever you feel most comfortable participating. A couple more announcements. We are excited to continue growing our medical staff and our team of specialists. We have just this month welcomed 2 new providers to our Steward Medical team, our Steward Medical Group team, that is. So we have first Amber Lippa, who is a physician assistant. She has joined our new Steward Digestive Disease Center of Taunton practice. So she joins Dr. Alexis Pappas. They are located in the Thayer building at Morton Hospital, Suite 2200, so up on the second floor. And that office specializes in gastroenterology, so a variety of GI issues that they are able to treat. Dr. Pappas just joined us recently, a couple months ago, and that is when that office first opened. It's our first Steward Medical Group gastroenterology practice, and we are very excited to have them both. Now, Amber, who just joined, will also start seeing new patients in that office in August, starting next month. So if you want to learn more about the Steward Digestive Disease Center of Taunton, or if you would like to request an appointment with Dr. Alexis Pappas or Amber Lippa, who is the physician assistant who just joined, you can call their office, which is 508-828-7740. Again, that's 508-828-7740, and they would be happy to speak with you and schedule an appointment for you. We are also happy to welcome a second new mid-level provider to our Steward Medical Group team, and she has joined our SMG Orthopedics and Sports Medicine at Northwoods practice. Her name is Veronica Walzak, and she is a physician assistant, and she joins our team of providers, which include Dr. Matthew Werger, Dr. Christopher Naka, and Dr. Mark Adams at that practice. They are located at Northwoods Medical Center, 2007 Bay Street, Suite 100, up off of Bay Street in Taunton. And she is now also accepting new patients in that practice. And just a note on that practice, the SMG Orthopedics and Sports Medicine at Northwoods, they did move over to that location a few months ago, but they just, as of this week, moved into a new suite in that building. So they used to be located down in the basement, but they are now located in Suite 100 at Northwoods Medical Center. So for more information on their areas of expertise, they do specialize in physiatry, joint replacement, arthroscopic joint replacement, and sports medicine. You can call their office. It is 774-409-2009. Again, that's 774-409-2009. So now with the addition of Veronica, there are 4 providers in that practice, and they are happy to treat any of your orthopedic or sports medicine related injuries or concerns, either surgically or non-surgically. It's a great team up there, so give them a call if you have any areas of concern. And in prior shows, we had mentioned that we also recently welcomed a new family medicine specialist to our team. She is Dr. Rachel Tago, and she joined the SMG Primary Care at Northwoods team. She will see patients of all ages because she does specialize in family medicine, and she's now accepting new patients. You can reach her office or schedule an appointment with any of the providers in that group at 508-822-2266. Again, that's 508-822-2266. So we are thrilled with all of the new providers and specialists that we have welcomed to our team. We're so happy that they are here in our community and offering the services that our community needs. Anytime you can also call our Doctor Finder line at 800-488-5959 to search for a provider, or if you go online to providers.steward.org, you can search for any providers by specialty, by location, and schedule an appointment or request an appointment online as well. So that wraps up all of the announcements that we have for today. We hope you enjoyed today's show. Just a reminder how you can contact us. You can email us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. Anytime you'd like to share any feedback or questions or suggestions for future shows, we would love to hear from our listeners. And a reminder that you can also follow us on Facebook for the latest happening at Morton Hospital, including events and announcements and new services, new doctors, and see all the fun that our team is having here at the hospital. We're doing some fun things for employee morale throughout the summer. We're doing some fun Friday theme days, so you can check out all those pictures and see what our team is up to on our Facebook page, which is facebook.com/Morton Hospital MA. We want to thank you again for listening, and we look forward to joining you again next week for more Morton in the Morning, happening Wednesdays at 11:05 a.m. right here on WVBF, your hometown radio station. Thank you again, and from all of us at Morton Hospital, we hope you have a happy and healthy week. We'll see you next week. If you're looking for weight loss that lasts, look no further than the Stewart Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.